Hello, this is Dr. Mark Katz of Advanced Podiatry, and today we will be doing a permanent nail correction. And currently we are putting on a tourniquet so that we don't get bleeding, and the reason for that is that we will be using a chemical to kill the root of the nail so that it is permanent and it does not grow back. So we don't want it to be diluted with bleeding. We're going to start off by cutting back the side of the nail, and we do that with a specialized instrument which gives a nice clean edge of the nail so it looks cosmetically pleasing after the procedure and after it is completely healed. So we are taking back one side of the nail. This patient has a very severe curve to the nail and very much pain, and therefore we are doing both sides. This patient has had infections in the past, and now we are taking care of this. So now we're loosening up the nail, and I'm using an instrument that causes little damage. Just to note, there are no incisions into the skin and no stitches used during the procedure. So at this point, we've loosened up the nail, we've cut it back, and now I'm going to remove a portion of the nail that is the ingrown portion, and this is the piece that causes the pain, and you can see how very large it is in just a second here. So there it is. That's just the side of the nail, and that is a very large portion. So this is going to be the main part of where the relief comes from without having that large piece in the corner. We're going into the other corner now, and we will be taking out that side of the nail just like the other side. And again, it's a very large piece, and this will give the patient very significant relief in the long run. Okay, so now that we have all of those taken out, we now are going to prepare the root, and that is at the base where we're using this instrument called a curette. That is actually like a little ice cream scoop, and we're actually cleaning out the base, making sure there are no cells remaining that can cause regrowth of the nail. And by doing this curette procedure right now, we can remove any remaining cells or anything that will regrow the nail. At this point, I have found a small piece still remaining, so I'm taking that out, and that'll again prevent recurrence of the ingrown nail. And we're doing a little more curette to the area. As you notice, there's very little bleeding to the area. And now we're going to prepare the root. The root is at the base of the nail, and that area is going to be prepared by using some gauze, and that gauze is going to be placed into the base in just 1 second, and that gauze is going to dry out the area and make it completely free of any blood or fluid, because we're going to put the chemical in that area, and that's the chemical that's going to basically kill the root of the nail and allow the remainder of the nail to grow, and you'll have just a normal nail growing without the side pieces. And again, like I said, it's cosmetically pleasing. So here we go. I'm placing the chemical at the root. I am using a chemical called sodium hydroxide. Some doctors use phenol. I'm using sodium hydroxide. We have short applications of the chemical to kill the root. You'll get a little bit of darkening of the area, which is temporary, and we'll do 2 applications at the root of the nail. Obviously the patient feels nothing as she is numb, and now we are going to neutralize that with actual vinegar, and that's a real chemical reaction where we completely stop the process of the sodium hydroxide burning the root. Now I've removed the vinegar, I've cleaned everything off, and I'm going to go ahead and put some antibiotic cream, which is Silvadene. Silvadene is a cream that is for burns, so we use it as an antibiotic and a burn cream. Following that, I'm going to place a bandage on, and that is going to be the end of the procedure. We'll take the tourniquet off, and the patient will be given instructions that are very simple. We use something called an Amerigel kit, and that will be easy to take care of. Patients typically have minimal pain with this, and usually just take some Tylenol if needed. So thank you for watching, and We will continue our series of various types of procedures that may interest you, and there you have it.